personalized, also known as a consumer-driven healthcare, demand-controlled healthcare. Let's talk about access to care. Today's topic is access to care. Establishing access to healthcare by first creating a better access to an affordable health insurance. That is the first thing we need to do. So let's look into it, folks. Let's look into personalized health insurance against most critical metrics. Most critical metrics. Three most important aspects of any healthcare reform are how it measures against the standards of number one, increased access to medical care. That is number one, increased access to medical care. And number two, improved access to the healthcare, improved quality care, improved quality of care. And number three, lowering the cost of the care. Those are the three fundamental aspects to access. The purpose of insurance is to purchase protection before the onset of a problem. We understand that, folks. For example, if we can buy a hurricane insurance when a named storm is heading your way, an imminent potential claim from a known pre-existing condition generally precludes the purchase of insurance coverage for that risk. So buying a health insurance to gain access to healthcare is different. Healthcare is different. Pre-existing conditions are prevalent in most of us. Some individuals are born with a congenital pre-existing health condition. Over time, many will suffer from accidents and illnesses. Others will acquire chronic conditions. Still, others must deal with normal disabilities of aging. Before Obamacare, health insurance companies used an analysis of medical records and policy application information to profile individuals or groups seeking health coverage. So insurance companies wanted to determine the extent of any pre-existing sickness or illnesses. This is called risk selection, folks. This is called risk selection. Before Obamacare, most states allowed health insurance companies the unilateral power to deny individual applicants or groups to access purchasing health coverage. Many insurance companies abuse this risk selection power by cherry picking only the healthy customers. These two frequent underwriting abuses, these are the most frequent underwriting abuses, increase the number of uninsured individuals, folks, especially Disadvantaged were those who tried to leave a job where they had employer sponsored coverage. They were affected. Buying an individual policy was difficult. Companies limited access by using the most extreme underwriting risk selection process. In general, in general, limiting access to health insurance means limiting access to medical care. That's a fundamental truth to that. So, personalized health insurance empowers, empowers consumers and assures access to affordable health insurance for all Americans, for all Americans. Pre-Obamacare study, pre-Obamacare study by American Health Insurance Plans, American Health Insurance, so-called AHIP, American Health Insurance Plans showed 88 to 89% of the health insurance application that went through the medical underwriting process resulted in offer of coverage, a significant resulted in the offer of coverage, but a significant number of applications for individual health insurance never even made it to the medical underwriting process. Never even made it to the medical underwriting process. Some applications received were either not processed because of lack of citizenship or denied for non-medical reasons. You see, non-medical non-medical reasons like lack of providing, like failure of providing some information on the application. So acceptance rate varied by age. Varied by age. Insurance companies accepted 95% of people under the age of 18. See, this is the beauty. They accepted under the age of 18 folks, but only 71% of the people between the ages of 60 to 64. So older folks are more likely to be rejected for pre-existing conditions. Overall, all ages, 2 to 3% of them were deemed uninsurable. That's what happened. 2 to 3% of folks were deemed uninsurable by the insurance companies. In total, 12% of the applications were rejected by insurance companies for medical reasons. For medical reasons. It is these 12 critical 12% that are empowered under the personalized health insurance to access affordable coverage they need and to cover any pre-existing conditions, folks. So these critical 12% do not come from any one set of employer plans or from any particular sector of the society. They come from all spectrum. Many are working for small businesses, work multiple part-time jobs. See, this is the beauty, folks. Work multiple part-time jobs, are self-employed. Most are hard-working individuals and families seeking to provide for themselves and to protect their families. So personalized health insurance addresses these issues so that no one who are covered is dropped from the coverage. No one is dropped from the coverage, and no new persons are left behind under the personalized health insurance or left behind unable to purchase insurance that covers the pre-existing conditions. Where personalized health insurance address those who are left behind. It is the key. It is a key for the access to care. So personalized health insurance passes with flying colors, folks. Flying colors. Secret here is that affordable health insurance provides the access to care. This simple and obvious concept is frequently missing in most of the health reform proposals, folks. So personalized health insurance focuses on who needs the most. Those 12% of the folks were having difficulty because of any pre-existing. So personalized health insurance passes and focuses on those 12% who could not get the health insurance. As a result, they could not get the access to care. So that's the beauty of having a personalized health insurance, so-called health insurance personalized or consumer-driven healthcare. I hope you got my points. So access to care depends on access to an affordable health insurance, folks. Thank you for listening. This is Consumers Doctor on the behalf of Foremost Organization. We will see you in the next episode. Goodbye.